Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
I'm Dr. Tamajit Chakraborty. I'm a consultant neurosurgeon practicing in Kolkata. I'm a brain and spine surgeon. So today we'll discuss about epilepsy, what is the disease and how it happens, and what are the treatment. As I'm a neurosurgeon, I'll rather discuss about the surgical management also of epilepsy.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
See, the thing is, epilepsy is a condition. It is basically a brain condition. So what happens whenever we think, whenever we do something, there are n number of neurons which is there within our brain. So it is connected electrically with each other. So it has a rhythm of impulse. It has a pattern of impulse that is electrical stimulation. So what happens when there is any an abnormal electrical stimulation that is happening, and that abnormal electrical stimulation suddenly there is an outburst of abnormal stimulation, then there is a phenomenon that happens. We call them epilepsy.
What is epilepsy?
See, whenever we are talking about that particular phenomenon, this is one episode of seizure attack, one episode of convulsion, rather you can say. Now, what happens whenever it is happening to a person? Uh, there is more than two episodes of unprovoked seizure attack. That means what? The person is not having any brain infection. The person is not having any recent history or past history of head injury. The person is not having any kind of brain tumors. That means which provokes seizure. So the person is not having anything which can provoke a seizure, but still the person is having the attack of fits, that electrical abnormal activity that is going on at least two times unprovoked. Then we call them epilepsy.
What are the different types of seizures and do they affect people differently?
See, there are a lot of varieties of seizure, but in general, we divide them into two divisions. One is whenever there is any attack, the person that is so severe and that is affecting both the lobes. We have a right-sided brain, we have a left-sided brain. If it affects both the right and left side of the brain, and suddenly the person becomes unconscious, we call them a generalized kind of attack. But when there is attack which is happening in a particular area of the brain, say there is a right-sided problem, right-sided area, then there are different features. Just for an example, say there is a right-sided brain which controls the left side of our body, and the left-sided brain which controls the right side of our body. Now, just for an example, the person is having an abnormal electrical impulse in the right-sided hand areas. So then what will happen in the left-sided hand movement, which is not voluntary, which is an involuntary hand movement of the left side, that will happen. This is what is called partial seizure or partial attack. Sometimes that partial attacks become generalized. So we call them the secondary generalization of attack.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
There are two types, which is having some cause, which is not having some cause. So whenever there is a cause, particular cause, we know this is a problem, and that is why the patient is having fits. We can treat them. But in many of the patients, they don't have any known cause. The brain scan is normal, that there is no signs of infection, there is no tumor, there is no head injury, but still the person is having seizure attacks. Sometimes that may so happen in case of younger age group because of high grade fever. We call them febrile seizures. Sometimes in younger age group, without any cause, the seizure can happen, and also to the older age group, whenever the person gets old, because of some electrolyte imbalance, say low sodium and all this, the person will have a seizure attack or epilepsy. So these are basically the reasons of epilepsy. But we have seen many cases. We can't find anything.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
See, always we talk about two important things, the one thing that uh, that precedes an attack, you know
Yeah.
sometimes that may so happen. So we call them the aura. So sometimes the patient is having some kind of, say, abnormal blush of light, abnormal sensation, sensory problems. The patient is having a sudden increase in their heart rate. The patient is having sudden tremors and abnormal sounds in the, you know so these are the this precedes an attack of epilepsy. So we always teaches our patient of epilepsy that what are the signs and symptoms of aura. At the same time, the signs and symptoms of epilepsy, that actually depends the which area is involving in the brain. Say the person is having an abnormal electrical impulse in the area of speech,
Yeah.
and that can lead to abnormal speech output. The person may murmur. Sometimes there is stammering of speech.
Mhm.
Sometimes there is complete speech block. We call them
Yeah.
aphasia. These are the problems. Say a person is having an abnormal impulse in their sensory area. That means a sensation. So suddenly the person will feel of abnormal sensation, sudden hot and cold temperature, sudden burning sensation, abnormal sensation. So
Yeah.
these are the problems. Sometimes the areas which controls our urine and stool, that may get involved, and
Mhm.
then is a cause of bladder and bowel incontinence.
Mhm.
So these are the associated problems, and these are the areas that may get involved in epilepsy. So the signs and symptoms will continue to happen.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
See, epilepsy is not a new problem. It is a problem we knew in the prehistoric era. We have
Yeah.
a lot of literature that we have seen in different manuscripts of different
Yeah.
historians, which describes a problem which exactly mimics epilepsy. Now,
Mhm.
what happens during the epilepsy in most of the seizure attacks, especially in case of generalized seizure attacks, the person
Mhm.
suddenly gets unconscious. Number one,
Yeah.
before unconsciousness, there is a vigorous movement of the hands and feet. There's a turning of head. There is a facial deviation. There's
Yeah.
a there's a frothing.
Yeah.
So it itself looks very horrible. So with that horrifying looks, there are a lot of myths involved with the epilepsy. It is
Yeah.
seen that there are a lot of myths. So still now, even in the remote places, they
Mhm.
think epilepsy is such kind of demon attack. They see
Mhm.
epilepsy is such kind of social stigma. They
Yeah.
segregate those people who are having epilepsy. But
Mhm.
what is the problem? During the time of epilepsy, during the time of fits, the person needs more and more attention,
Yeah.
because it is a question of time. If you cannot resuscitate the patient, if you cannot change such certain postures, do some maneuvers, the person may die. So the
Yeah.
stigma has to be, it needs a social awareness. We have to educate our common people that it is a problem, or it's a neurological disorder. It is not such kind of demon attack or like this.
How does this stigma affect people with epilepsy?
Uh, this is what I've explained to you. That stigma is always there,
Yeah.
because epilepsy sometimes happen in a remote areas where the in general health awareness is not so good. People think that this is some kind of unnatural things. Hmm. And that
Yeah.
is why those kind of stigmas are there. We have to, the only way to get out of it
Mhm.
is social education, social awareness. We have to circulate the epilepsy related talks, epilepsy related awareness more and more, so that the general people get to know what is that. And one thing very important,
Yeah.
most of epilepsy what we have seen in our clinical practice, that can be controlled with a proper medication,
Mhm.
with proper care. So it is easily controllable problem. Even it is not something which you cannot control it. So we need a proper care, we need a proper diagnosis and treatment for that.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Okay, so there are different uh, what I can say, different precipitating factors. We call them the precipitating factors. That means what? There are few factors which actually increase the chance of epilepsy. So for all the caregivers who are looking after a patient of epilepsy, what we suggest them, the first of all, a good sleep is needed for that person. At least 7 to 8 hours of a sound sleep, which is
Yeah.
needed. Because we have seen in our research and clinical practice that sleep deprivation is one of the very important cause of epilepsy.
Yeah.
Number two is a regular timely intake of foods, because fasting, again, hypoglycemia, that is low glucose level, is a very important cause of epilepsy. Third, it's a precipitating factor, not cause. We can say it's a precipitating factor of epilepsy.
Yeah.
If the person is already taking medicines for epilepsy,
Mhm.
you cannot miss it. You have to be very much particular and careful about your doses. You have to just take it wherever you are, wherever you are going. You are going for a trip, you are having some, roller coaster ride in your office, but you have to have that medicines in a regular interval. Number four
Yeah.
is anxiety and depression because of different mental changes, and that's
Mhm.
sometimes precipitating attack of epilepsy.
Mhm.
In a children, the high fever. So although there are few papers right now at present which suggest that the low grade or high grade, the temperature is not
Yeah.
very important. It is a fever that is an important precipitating factor for that.
Mhm.
So these are the common things we have to look after. We have to look into while we are seeing a patient of epilepsy, or we are a caregiver. We are looking after a patient of epilepsy.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
See, there are two, three important issues. We
Yeah.
have to see what is the functional condition of the patient, what is the functional ability of the patient,
Yeah.
whether the patient can perform the normal day-to-day activities or not with the epilepsy.
Hmm.
What we always suggest, if the person is having epilepsy, there are few activities what he should avoid. He should
Mhm.
avoid driving. He should avoid a high altitude. He should avoid those precipitating factors to settle. And at the same time, we have to rehabilitate this person in such a way so that he can continue his job. He is not jobless.
Yeah.
If he is having a treatable cause of epilepsy, what are the treatable cause? Say somebody is having a brain tumor,
Mhm.
which can be easily treatable, whatever the way we can treat it. So we have to be that brain tumor or that treatable cause has to be removed. you
Mhm.
know that is the best line. There are some other things which can precipitate epilepsy. Say somebody is having there is a condition we call the hippocampal sclerosis. It is a surgically treatable condition.
Mhm.
So sometimes we do a epilepsy surgery by removing the part of the brain which is actually damaged and which is a focus of abnormal electrical impulse. We can remove that area so that the person can be cured from the epilepsy. There are few other surgeries that we suggest to our patients where we are not finding anything. We are not at all finding anything, but there are few papers, there are few research which is going on. And
Mhm.
just for an example, I'll just give an example, something called vagus nerve stimulation. That's a very important surgical step. We do it for the epilepsy patients, and we have seen a lot of improvement. We have seen the seizure attack is not happening regularly after this.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
So first of all, the thing, whenever there is any seizure attack,
Yeah.
please not keep your patient in a supine position. Turn.
Mhm.
Please turn them laterally.
Yeah.
Hmm. Sometimes we do put something in between the teeth so that it is not cutting the tongue.
Mhm.
The airway protection is very important. Whenever the patient is unconscious, rush him to any nearby hospital, because sometimes during the epilepsy there is a sudden airway obstruction, and because of the sudden airway obstruction there is a less oxygen to the brain. We call them hypoxic ischemic damage. So to
Yeah.
prevent this, there is few medications routinely available. We can it's emergency medications. We can keep them, and whenever there is any sudden epileptiform attack, we can use those medication to abort the attack then and there. Okay.
Yeah.
And one thing we always suggest to the caregivers, so
Mhm.
whenever the patient is having a fit, say the patient is standing and suddenly there is a epileptiform attack, just make this patient at least sit on the floor, on lie down, so that there is any if any chances of head injury, or if any chances of limb injury or orthopedics injury, we can prevent those things.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course.
The final thing is that that is all I'll say about that epilepsy stigma. So
Mm-hmm.
it's not a it is not sometime something unnatural. It
Yeah.
happens
Mm-hmm.
as all of our organs may cause some problem. The brain also can cause some problem. Epilepsy is one of those problems. It
Yeah.
is very much treatable. First of all, go to a neurologist or go to a neuro doctor to get evaluated why the seizure attack is happening, whether there is any treatable cause, and why it is happening so, and get treated accordingly. So it is always better to know the things, to diagnose this first, and to treat.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.